Welcome to the Dr. Mama Says podcast, where you will hear a variety of timeless tips on parenting and healthcare. Thank you so much for joining today, and now it's time to get on with the show.
Hey there, everyone. I'm Dr. Burton, the host and creator of the Dr. Mama Says podcast. Thanks so much for joining me again today. This episode is going to be discussing strep throat, which is a really common cause of throat pain. I've already discussed how most tonsil infections are caused by viruses, but when they are caused by bacteria, antibiotics are useful. Strep throat is more than a simple tonsil infection, and many parents assume that because it's a common, normal childhood illness, that kids will outgrow it and there'll be no problems. However, it is extremely important to know that in both kids and adults, there are some potentially life-threatening or at least very severe strep throat complications. And this helps you to know why physicians always treat strep throat much more aggressively than any other cause of a sore throat. First of all, what is strep throat? Strep throat is a specific bacterial infection called Group A Streptococcus, more commonly Group A strep. There are lots of strep bacteria that cause infections all over the body. One of the other most common causes is one I discussed in my ear infection podcast episode, and this is one that's called Strep pneumoniae or pneumococcus, and this is the one that causes many ear and sinus infections, and I guess you can tell by the name it also is a bad actor when it comes to causing pneumonia. The point is, there are many different strep bacteria, but Group A strep is the one we all get concerned about when it's in the throat. So when we say strep, we mean Group A strep. So strep affects tonsils and the throat. As it says in the name, this is not just tonsillitis. This is pharyngitis. Let me just take a moment for some nerd talk. The pharynx is a fancy name for the area in the back of the throat. This includes the area in the back of the nose, the back of the mouth, and the area in the lower back of the throat behind the tongue around the voice box. So when infections, whether it's due to a bacteria or a virus, happen in the pharynx, all areas have the potential to be involved. And in general, this is called pharyngitis. Not a specific site, but a general region, one that we call the throat. Tonsils happen to sit in the pharynx, and because they are similar to lymph nodes, they step up, or maybe we say they swell up, to help fight infections. Because tonsils are the front line to fight infections, they often get filled with bacteria, the bacteria gets trapped in there, and then it becomes a problem. As discussed in another podcast, tonsils that become a problem become a recurrent tonsil infection issue, or lead to sleep-disordered breathing, sleep apnea, or become too large and affect the eating. Anyway, the concept that strep throat is more than strep tonsillitis is an important concept because many people have their tonsils removed but continue to have strep throat infections. And it's super important to remember strep throat makes up a very small number of sore throats. So who gets strep? Anyone can get strep, but there are some factors that have an increased risk of getting this infection, such as it's more common in children than adults, usually occurring between ages 5 and 15. It's rare in kids younger than 3, but as a pediatric ENT, I gotta tell you, I've seen more than my fair share of toddlers with strep throat. Adults who are most at risk of getting strep are parents of school-age kids or adults who are often in contact with kids like daycare workers and teachers. Basically, the more you're exposed to sick kids, the more likely you are to get infected. So how do you get strep throat? Group A strep usually causes symptoms after it enters the nose and the mouth, but it can live in these areas without causing a disease. And of course, just because you're exposed to an illness doesn't mean you're going to catch it. This is true of most infectious problems. Everyone who's exposed to chickenpox or measles, they don't catch them, even though these are aggressive viruses. Sadly, this little nugget of information is what empowers the anti-vax crowd. By not vaccinating their kids, anti-vax parents are banking on the fact that not everyone will catch the illness, or if they do, they'll only have a mild case. This is not how healthcare works. Healthcare is indeed meant to treat illnesses, but it's also trying to prevent them. Understanding the diseases and how they're spread is so important for prevention. And when it comes to some of these most aggressive viral illnesses, the best treatment is prevention, and that means vaccines. I have previously shared my personal truth about witnessing and experiencing the vaccine revolution in a blog post that I wrote a few months ago. Always remember, #vaccines work, Vaccines cause adults. Okay, now let's get back to the topic at hand, strep. It is a rather aggressive bacteria, and it can spread easily between people. All infected people don't have symptoms or seem sick. The people who are infected can spread the bacteria by coughing or sneezing, and this creates little droplets of mucus that contains the bacteria. So you can catch strep by breathing in the bacteria that have been sneezed or coughed into the air, or if a sick person touches their eyes, nose, or mouth, their hands get contaminated. So anything that they touch can now be passed on to others. And of course you can catch strep by sharing drinks and food from a person that has strep, or sharing their toothbrush. Ew, just don't do that. One last area strep can cause an infection is in the skin, and this is called impetigo. Impetigo is a really common, highly contagious bacterial skin infection that again usually affects young kids and infants, but any age can get it. Impetigo usually shows up as red sores on the face, usually around the nose and mouth, sometimes on the hands and feet. The sores have pustules and the liquid contains the bacteria. It's very, very contagious if you touch the open sores or anything that they've touched after touching their face. You can sometimes recognize this rash as something specific because when the sores burst, they make a distinctive honey-colored crusted area. So if you see this on the face and mouth of a child, it's probably going to be impetigo. Now to be clear, impetigo usually or very commonly is caused by another bacteria, staph, but many people don't know strep is also a big offender. This is important because of some of the complications that strep can cause. I've heard many stories from parents who report infections that are passed from their pets. Now, experts feel this is highly unlikely, but there are reported stories that must be taken seriously. Bottom line, as a scientist, I understand that very few things are 100% yes or no. So we make statements based on the most likely answer. So your take-home message on this topic is it's possible that your pet passed it to you or your family, but strep is usually not passed this way. Now I need to confess that I went down the internet rabbit hole reading about dog tonsillitis. Yes, it was fascinating. Sounds like the same disease I see in kids. There are pictures of swollen, infected little doggy tonsils, and it's more common in the small dog breeds. My favorite part of this new learning was that it actually says tonsillectomy is rarely recommended for pets, but instead it's the last option considered for treating recurrent infections or those that don't respond to medication. What? This sounds just like my patients. But please, let's imagine this surgery on your little doggy. It's an ugly post-op recovery in humans, and there's a significant concern for post-op complications. I just cannot get my brain wrapped around caring for a dog with some of the descriptions that I give parents for post-op tonsil pain. It's kind of like fire, a constant fire in the back of your throat. Kudos to you if you've had this done to your dog. In fact, if you or anyone you know has had a dog with a tonsillectomy, please message me or email me. I need to chat more about this. Letting my nerd flag fly. All right, let's get back to strep. What are some of the classic symptoms? Basically, the ones you know. Throat pain, pain swallowing, red swollen tonsils. Sometimes they can have pus, sometimes not. There can be tiny little red spots on the back of the throat, often on the roof of the mouth, and it looks like someone took a little red Sharpie and made little polka dots there. You can have swollen lymph nodes on your neck, fever, a rash, sometimes called scarlatina, body and joint aches. But headache, nausea, vomiting, stomach ache, those are really some of the most common symptoms that I see in my patients with recurrent strep. Parents often think it's a viral infection and are surprised when they go to their pediatrician and find out it's strep throat. But many sore throat symptoms give hints that it's probably not strep. So although it's not always clear what the cause of the sore throat is, there are some symptoms that physicians consider to be more likely a viral infection. And these include things like cough, runny nose, hoarseness, or conjunctivitis, also known as pink eye. These are not something that are typically associated with strep. Diagnosing strep can be very easy with a simple test, and it gives very fast results. Even though physicians may be suspicious that it's strep, you can't absolutely know if it's strep until you do the test. But if you are seeing an experienced physician, we often know. There are some signs when you look at the throat and the tongue. Sometimes there's even a certain smell that says this is strep. but only the rapid strep test or the throat culture can determine if it's truly group A strep. A rapid strep test involves swabbing the back of the throat and running a test right there. The test is very quick in determining, yes, it's strep. If the test is positive, doctors can go ahead and prescribe the antibiotics. But if the test is negative, the doctor still might suspect it because of our clinical experience, and so they often will do a throat culture. A throat culture takes some more time to grow the bacteria. So while it takes time, it's important to do in some people because especially in kids and teens, they can get more of these complications from an untreated throat infection. For adults, it's usually not as necessary or as common to do the throat culture following a negative rapid strep test. Adults don't have the same risk factors of getting some of these complications. I'm a pediatric ENT, so you might want to just check with your family physician, ER doctor, urgent care to see what is their criteria for doing a culture in the adult population. So once you diagnose strep, how do you treat it? Physicians are constantly sounding the alarm to avoid asking us for antibiotics because we don't want to overprescribe them. But antibiotics are really, really important for treating appropriate diseases, and this is one of them. Antibiotics are used to treat strep, and it works very fast. Most people feel better in 1 to 2 days, but if it takes longer to improve, sometimes there's another problem, like a viral infection or a sinus infection, and they are not responding to the simple antibiotics used to treat strep. Either penicillin or amoxicillin are usually recommended as the first choice for people not allergic to penicillin. Usually, if we use other antibiotics, there is a penicillin allergy, and we need to think about treating more complex infections at the same time, like that sinus or ear infection. So what about those people that test positive for strep but have no symptoms? These are the people often called a carrier. Most of the time, these people don't need antibiotics, but this can be tricky. Carriers do have the bacteria and are unlikely to spread it or to get complications. The operative word here, unlikely. So if family members are repeatedly getting sick, what should you do? Yes, of course, I've had this situation many times. One child repeatedly makes some family members sick, but other family members are not. Antibiotics don't get rid of the infection in either patient. So whose tonsils should be removed? Should it be the ones who keep getting sick since they're clearly susceptible, not only from the carrier family member, but also from others who they may run into? Or do you remove the tonsils of the carrier? That is an interesting dilemma, and I roll it out there and I say, yes, there's a problem. Somebody needs to get rid of this source of infection, but different families approach it from a different way. Something to think about. So why are antibiotics used for strep? It's true strep throat can resolve without antibiotics, but there are some very clear benefits to using antibiotics, including it reduces how long someone actually stays sick, makes the symptoms go away faster, and can help prevent the bacteria from spreading to other people. But more importantly, it prevents some of these serious strep throat complications I'm about to talk about. Finally, on to the topic I wanted to discuss in this podcast, but I needed to make sure we were all on the same page about strep in general. So what are some of these severe strep throat complications? They are not common, but they can happen, and when they do, it can be a big deal. A huge deal. Number 1, abscess pockets around the tonsils. This is called the Peritonsillar Abscess. Yes, it can happen with any bacteria, but strep is the most common offender. I have seen more of these in kids who either have only taken part of their course of antibiotics or were allergic to penicillin, so antibiotics were avoided or used short-term to, quote, avoid becoming allergic to more antibiotics. Well, just a sidebar here, taking your antibiotics as prescribed is important. The dosing of medicine is based on our science, research that says this is how this medication works the best. So when you stop early or modify how you're taking them, you're also modifying how the problem will respond to treatment. In teens and adults, peritonsillar abscesses can be treated in the emergency room by putting a needle into the back of the throat to remove the pus or making a small cut in the back of the throat and draining it. So yeah, can you imagine this in young kids? Nope. So young kids have to be taken to the operating room to drain their abscesses. The next severe strep throat complication is rheumatic fever. This is a heart disease, not as common so much these days because antibiotics are so commonly used. But I have 2 personal experiences with this complication. First of all, rheumatic fever is not a problem due directly to the bacteria, but instead it occurs because the immune system mounts a reaction to attack the bacteria. But instead of only attacking the bacteria, it attacks the heart valves. My grandmother, She was the original Nana of my family. She was a young nurse who developed rheumatic fever many years ago. The bacterial infection led to damage of her heart valves, and it affected how her heart was able to work. She was starting to go into heart failure. Yes, I did say long time ago. How long? Well, her valves needed to be replaced, but these were not really common. But because she worked at a hospital in Boston, she was connected to a lot of researchers, and heart surgery was really just starting to bloom. She was selected as a candidate to have her heart valves replaced. She was one of the pioneers who helped surgeons in the Boston medical community perfect the heart valve replacement procedures. She lived a long, healthy life, and actually many years later had her valve replaced again when the quality and techniques for heart surgery had improved. My second experience with rheumatic fever occurred during my internship in Hawaii when I was working at Tripler Army Medical Center. On a weekly basis, military planes would bring sick people from the Pacific Islands to our hospital. Since they did not have access to antibiotics, rheumatic fever was fairly common. As an intern, I listened to hearts of sick kids who had 2 or 3 damaged heart valves due to something we don't see much over here because of our great health care. Never take things for granted. For several months while I was on the pediatric service, I took the lead in treating and preparing kids for heart surgery, all because of untreated strep throat. This potentially deadly problem still occurs in many areas around the world, especially like in the sub-Sahara Africa region, South Central Asia, and in certain areas in Australia and New Zealand. The next severe strep throat complication I want to talk about is post-streptococcal glomerulonephritis. What a mouthful! But again, this is basically a kidney disease. Once again, not the bacteria causing the problem, but the body's immune system reaction to the bacteria leads to an inflammation and an irritation of the blood vessels around the kidneys. They swell up and they don't filter urine well. The symptoms then can include swelling in the legs, hands, face, blood in the urine. There's often no specific treatment for this condition, but the strep infection can be treated with antibiotics, and measures then have to be taken to support the kidneys while they try to heal. Kids usually recover from this very well within 6 to 8 weeks. Adults, they're more likely to develop long-term complications like high blood pressure, permanent kidney damage, or even kidney failure. And now the last strep throat complication I want to talk about is called PANDAS. P-A-N-D-A-S, like panda bears. PANDAS are the initials that stand for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. Yeah, now you see why we say PANDAS. Once again, this is a problem that occurs due to the immune response to strep. But this time there are neurologic problems because the inflammation occurs in the brain. The symptoms often suddenly occur and include things like behavior and personality changes, tics, and new onset obsessive compulsive disorder, some OCD. The symptoms can occur in episodes, but eventually they may become more severe, progressive over time, and eventually become constant. I have personally treated many patients who were suspected of having this strep throat complication, but they never actually had a diagnosis of strep made. If cultures are negative, it can be really difficult for physicians to proceed with treatment. This has become a very controversial problem because there's clearly an inflammatory neurologic problem, but it can be unclear if it was caused by strep, another bacteria, or if it was viral induced. The treatment of it also is very difficult to determine. Some people have been treated with short-term antibiotics, long-term antibiotics, intravenous gamma globulins, which help the immune system to fight reactions, and even have been recommended to ENT physicians for surgery. I plan to spend an entire podcast on this because there are many sides that need to be presented, but I want you to know that it exists. It's important to protect yourself and others from getting strep because people can get strep throat more than once. And just because you get it, it does not give you any immunity to protect you from getting it again in the future. Wouldn't it be great if there was a vaccine to prevent strep? Well, there isn't. So doing things like to prevent the spread of any other illness, it's helpful here. Basically, use good hygiene. Wash your hands as often as possible. Cover your mouth and hands with a tissue when you cough or sneeze. Put that used tissue in the trash can. Or cough or sneeze into your upper sleeve or elbow, not into your hands. Wash your hands with soap and water for at least 20 seconds. Or use an alcohol-based hand wash if soap and water is not available. You also should wash glasses, forks, knives, spoons, plates after anyone who is sick has used them. After they're cleaned, they're safe for everybody else to use. They don't have to be kept separate. So there you have it. This seems like a really good place to end. And I hope you learned more about strep throat and understand that it is not just a simple disease because it can lead to some severe, potentially permanent, long-term complications. For now, I gotta go. Thanks so much for joining me today, and I look forward to you coming back to check out another episode soon.
I truly want to thank you for spending your time listening to Dr. Mama Says, because without you, there would be no podcast. If you enjoyed what you heard, please go to iTunes and consider leaving a 5-star rating. This will help gain the support needed to continue bringing new and exciting content. To review information presented in this episode, a summary of the show can be found on www.drmamasays.com. And don't forget to subscribe. Hope you come back and listen again soon.